Well, it's been about a month since the Sturgis motorcycle rally kicked off in South Dakota, but a new study has this big event back in the headlines and trending online this morning. And our digital dive will explain why this study is calling the event a super spreader of COVID-19. Now, the study, which was done by the IZA Institute of Labor Economics, claims that Sturgis may have caused more than 250,000 new coronavirus cases. It looks at public health costs of super spreading events and estimates cases connected to Sturgis could cost more than $12 billion. So here's something important to note, though. According to NBC News, the nonprofit company's findings have not been corroborated by epidemiologists or public health officials. More than 400,000 people attended the 10-day events where there was minimal social distancing and mask wearing. In South Dakota, 124 people who attended Sturgis tested positive for COVID. A Minnesota biker was the first person to die of COVID-19 after contracting the virus at Sturgis, with another 50 Minnesotans testing positive after being infected there. South Dakota Governor Kristen Noem is pushing back hard against the study, calling it fiction and an attack on people's personal freedom. Sturgis was trending on Twitter overnight with thousands of people talking about this story online. Now, Gia, a lot of those comments were saying that Sturgis rally was very irresponsible for them to go forward with it, while others are pointing out that the numbers haven't been confirmed yet by health officials.
Yeah,
so there you have it.
We should also point out the folks there going said, hey, I'm going to risk it. It's, my right. And so there's that. But as we know, Alicia, a lot of people calling this a super spreader. Thanks. Chris?